And how did you find out about the Florida Neurological Institute?
One of the women that I teach with came running over to me one day and said, "You need to look into this. I think this might be helpful." And we started checking it out immediately, and it took us about 2 days to make a decision. We're going.
Great. And when did you first come here?
Last summer.
In July.
In July.
Okay, so July of 2000.
Exactly a year ago.
Okay, great.
Sweet.
And I know from personal seeing you that you were in a wheelchair that you came and you couldn't
Yes.
walk, correct?
Yes.
Tell me what's been happening this past year.
Well, I've regained some use of my arm. It now moves, which it didn't move when I came in. My hand, my fingers are starting to function a lot better. I can grasp and grab things and hold things. And in fact, I'm finding out lately that the automatic movements are back. Like yesterday, my arm was itching real bad and I couldn't scratch it because it's just a place where I couldn't get to with this arm. And without thinking, this arm goes over and starts scratching it. You know, you're going, "Good boy, way to go."
That's awesome.
It's fun to see things return and happen automatically, because usually it's been to open the hand. I have to look at it, I have to know where it is, I have to watch the things open slowly, then on the thumb, do the thumb too, and just slowly watch every movement to make sure it's happening. But now all of a sudden, it's like I know where my hand is. It used to be I didn't have any concept of where my hand or my arm was. It could be on top of my head and it's down here by my hip, and I go, "Oh, no." And now all of a sudden that part's coming back, which is nice because I was left-handed.
Okay.
And the walking is improving. Not afraid of curbs and things like that like I used to be. Curbs are no longer an obstacle, and I'm getting a little bit faster.
You were able to sit in a normal seat on the jet, and you were able to scoot in, which you'd never been able to do before.
Able to scoot in on his own?
Yeah, just manipulate myself down the aisles of a jet and scoot in between seats, which before I couldn't do. Just the balance was not good enough, and just too many problems of doing it, so I always have to sit on the aisle seat on a jet, and just, in my opinion, so many improvements that it's hard for me to even consider where to start to talk about it.
Before we had to come to Florida, and he was able to decide that he wanted to get some shopping done, get to the store with someone, purchase the items, and bring them home, and then he organized his things to come to Florida, which is no small task from California. That was a big achievement.
Great. That's fabulous. So what would you say to someone who's thinking about coming here?
The same thing I have been telling everyone that I can find who, I've had people come up to me in shopping centers and ask what happened, because apparently I look a little too young to have all the symptoms that they recognize as a stroke. And I give them a long sales pitch, and I make sure they know how to get here. And again, it's people who will stop me and ask me what happened, because they'll see, it used to be my arm was always like that, frozen. Now when I stand up, the arm goes down automatically like it should. And the people would stop me and ask what happened, and I tell them when I was 54, I had a major stroke. And then I'd tell them, when I left the hospital, I was told I would never walk again, I'd never have the use of my arm again, I would be blind, I would not hear, I would not be able to talk, and I would be mentally retarded. And being mentally retarded, I've learned to work with.
He's not mentally retarded, he just won another award for teaching.
Oh, wonderful.
That's what makes that so humorous. On the flight, they had the ad for Dr. Hammesfahr's office in the Airways magazine. That was funny. And we were explaining to people that was where we were going. And I was sitting on the second flight with two ladies from Clearwater, and they didn't realize